Hello, Somerville. My name is Ed Halloran. Welcome to the Somerville Labor Show. We are back. We're here again with another great show. I have Jude here with me in the it's Somerville Cable Access and #1 technical director of all time. Also, Greg Hill is not here, who's our producer, another tremendous guy and a political activist here in Somerville. I want to thank everybody who watches us on Somerville Media Access, because this is such a it's a great honor to do a show like this. We enjoy it tremendously. And also want to thank our subscribers on YouTube, because our YouTube channel, if you're not subscribed, if you're not on there, take a look at it, because this is probably like our 52nd show that we've done since 2018. And this is a volunteer thing for us. We love it. We have a passion for it. So we also believe that we produce unique shows and things that you're not going to normally get to see all the time. So we hope that you enjoy it. It's local, but it also goes out all through Boston and beyond. So from the time the pandemic began, frontline workers kept us safe at home. Supermarket workers, delivery drivers, laborers, just to name a few, have the luxury of staying home. Medical staff who worked to save lives experienced so much heartache during this 2 historical years. Doctors, hospital staff, and nurses, for us there is a crisis, oftentimes nurses were called heroes, and rightfully so. Back in 2018, we had 2 guests on our show from the Massachusetts Nurses Association, and we really enjoyed that show. I got to tell you, it was so much information that we had gotten from the question 1 on the ballot. It had to do with patient safety limits. And we enjoyed it, and we're back here again, and we're going to be talking about that. And there was a question on the ballot 2018, and if it was passed, it would have regulated just how many patients a nurse could safely care for, which is incredibly important. Unfortunately, that question on the ballot did not pass, and then the pandemic hit, which further stressed the patient care ratio for each nurse. By now, most of us have heard of the St. Vincent strike in a hospital in Worcester, which is ongoing. I don't know if it's 220 days, it could be, who knows, 7 months now, since March 8th. And before I introduce my guest, I want to show you a brief video that kind of summarizes it.
We are approaching 100 days of striking in Worcester, the support St. Vincent nurses are getting from local politicians. That's happening right now on NBC 10 Boston. All right, let's go to Worcester. The nurses at St. Vincent Hospital have been on strike for more than 3 months now. Today they got some support in their fight for better staffing levels. NBC 10's Abby Nisgoda was there.
We never imagined we would be out here for this long.
3 months on strike, and nurses from St. Vincent Hospital in Worcester are still trying to get their voices heard.
We are still here. We are not going anywhere.
At a solidarity rally Saturday, they went over their demands. Their main issue, staffing levels. They want a 1-to-4 ratio of nurses to patients, and they say anything more is a safety crisis.
We're not asking for money, we're asking for patient safety.
Joining their fight, several elected officials, including Senator Elizabeth Warren.
We are here because we understand what this fight is about.
And Congressman Jim McGovern.
This is a fight that not only has implications here in Worcester, but all across this country.
There have been talks with hospital leaders, but there's no indication that they're any closer to a deal.
They ceased it. They said we're not meeting up.
In a recent statement, the head of Tenet Healthcare, which owns the hospital, said the staffing concessions that St. Vincent has made represent some of the most generous staffing contract language in the nation. We stand by the staffing, quality, and safety facts that we've shared with the public throughout negotiations.
Unreasonable. It doesn't even make sense.
The hospital has started hiring permanent replacement workers, but these nurses say they're undeterred.
They're not going to be able to break us at all.
It's already the longest strike nationally by nurses in over a decade. And as it goes longer, they say their voices will only get louder.
We will be here until we have an agreement to keep our patients in this community safe.
They have more rallies like this planned for the future. And when they're not here, they say they will be on that picket line every single day until they get a fair contract. In Worcester, I'm Abby Nisgoda, NBC 10 Boston.
Okay, so we're back, and here we are. Now you may be asking yourself, why are we doing this? Why are we, what this is happening in Worcester, it's not happening in Somerville. This is happening everywhere, everywhere. And all across the country, during the pandemic, This is happening everywhere, and there's a lot of brave people out there right now that are working very hard and picketing and have been out there for 7 months and want to bring light to that. So my very special guest to discuss these concerning issues and about our heroes, and yes, the nurses are our heroes, among many other people during the pandemic, of course. I want to introduce Katie Murphy, who's the Mass Nurses Association president. Good to have you.
Thanks, Ed. It's wonderful to be here.
I know. I'm glad you're here, and this is exciting for me because I think it's a really big issue for everybody. I had you and I had Susan Wright Thomas here in 2018. I had no idea. I mean, I knew it was a righteous cause. I knew it. I could, you could just feel it because you knew. I mean, we've all gone to hospitals. Our families have been to hospitals, and if you're going to be waiting all this time in these hospitals, you want to get really good care.
Right.
And if they're understaffed, we get it. And it could have been fixed by money, right? Could have, maybe a little bit, So I wonder if you could give us a brief overview of this, because the ballot question 1, patient safety limits, it failed, right? It did not happen, and I think that's really too bad. So give us a brief overview of what happens in a hospital and what patient safety, why it's so vital when our loved ones or us have to go into the hospital, and what we're faced with right now.
Thank you so much, Ed, and thanks for having us here in 2018 when we took our ballot question to the voters. We've been filing legislation to limit the number of patients that a nurse cares for at any one time for several decades, and it's passed in the House and not passed in the Senate. And so we finally said we're going to take this to the voters, and we thought we had a very compelling case saying just what you said. When we take care of more than a certain number of patients, depending on the specialty, patients are in more danger. And that just makes sense. Yes, it would certainly cost more funding, but when you think of having more nurses and we're getting our patients out of bed and moving around, they're not having as many issues as pneumonia and bed sores and blood clots, and they get out of the hospital faster. So I think actually it's money saving, and researchers have looked at that and come to the same conclusion. Yeah. So the Massachusetts Hospital Association outspent us 2 to 3 to 1.
As sad as it is, it has to come down to money, right?
It comes down to money, and they outspent us and confused the public. So the ballot question didn't pass, but we continue. We didn't miss a beat in trying to keep our patients safer. Right. So then, we're working on it, and because remember during that issue, the hospital said this shouldn't be a ballot question. This should be resolved at the bargaining table, and we said, okay. We take it to the table, and let's talk about St. Vincent. There are nurses there who have worked there 10, 20, 30, over 40 years. Some of them have their children working there. Right. I was on the picket line with nurses, who have said, this is my daughter. So you have nurses there. They are dedicated to St. Vincent, right? It's in a city, a bustling, energetic, diverse city, but it's a community hospital. So you really have that, that's the energy there. Those nurses are devoted to their hospital. Sat at the bargaining table for over a year with Tenet. Then when the pandemic hit.
Tenet is?
Tenet, oh, thank you.
That's okay.
Is a Dallas-based, it's not a healthcare corporation. It's an investment. It's an investment corporation. They own for-profit hospitals. Think about that. For-profit healthcare. Healthcare is a commodity. That's
makes sense. Only reason why it makes sense to me is because I know what skyrocketing medical bills are all about and prescriptions. And it certainly is a commodity. It's
it is a commodity, and it should be. Healthcare is a human right. That's what we also believe. So they're based in Dallas, so they really don't have any commitment to Massachusetts or Worcester, and this is interesting because we'll get to this point of labor being the voice. Our legislators, our local the Worcester City Council, Jim McGovern, who's the congressman, you know, up to the Senator Markey and Senator Warren, have done so much. They've been there, they've supported us, and we're still on the picket line.
Yeah.
So what's becoming so clear to me, that of course this is a labor issue, and this is where we need our strong voices and our standing together in the labor movement to resolve this. So back to March of 2020, the nurses who said, we are pausing negotiations. There's a worldwide pandemic. People are dying. We're pausing negotiations, and we are focusing completely on patient care. The nurses developed their recovery room into an intensive care unit so that the COVID patients, and you remember, patients were dying. Nobody had ever seen this level of people dying, young people, you know, older people coming in, dying. The nurses there said, we are going to do everything possible so that these patients get this care. But there were a lot of hospitals stopped elective surgery, elective procedures. So the nurses who worked in those areas were furloughed. So rather than saying, okay, I'm going to put you in this area to take care of patients, and I'm going to take you out of this specialty area to go take care of patients, they were furloughed, which we all said, we need all hands on deck.
You think?
So that's when we were the heroes. Wow. We were the heroes taking care of the patients. We knew that those were empty words.
Well, let me,
oh, sorry.
I just want to move a little bit because I want to ask you another question about this, because what I want to talk about too is give the viewers about the dire need, the understaffing, because you guys are completely understaffed, because that's where you were going with that.
Yes.
And believe me, being understaffed is not an easy thing, especially during a pandemic.
Right.
So I want to, like, if I can throw a few things out there, okay? Because what I have here, there's like these crazy little bullet points that I have. I don't know if people can see this stuff at home, right? But it says, this is what nurses say, right? So 86% do not have the time to provide adequate discharge planning, right? And then number 2, 90% do not have time to properly comfort and care for their patients, right? Number 3, 77% report they are assigned too many patients to care for at one time due to unsafe patient assignments. And we can go on and on about all the things that are going on with all of this, the discharge and everything else. I won't go into the whole thing, but I just wanted to mention some of that. But if question 1 was passed, right? Let's say that this. I mean, because I know I talked to Donna Kelly Williams back in April about this whole thing, and she was great. And I'm sure people are sorry to see her go, but they're happy to have you step in. That's a very difficult job that you've taken on. That's a very brave move on your part, because you're walking into something you never expected to see, never expected to happen, like most of us. What would happen? What do you think if the nurses had passed, that question had passed? Let's say it passed.
Yes.
Right? You got what you wanted. What do you think it would have looked like as far as having more nurses available to you?
So much safer.
Yeah.
We would have had more nurses at the bedside, and these patients were so sick. They were so sick, and everybody was on precautions. So if your oxygen level was falling, and I could look in the room, and the room is, behind doors and, special ventilation, normally I'd run right in there, give you some oxygen, give you some more oxygen. No. This time we had to stop, put on all of our PPE, and we were reusing it, and so we were sanitizing.
I know, because I talked to Donna about the mask cleaner at the assembly row about that, and she was furious over it. This light that cleaned these used masks. It was really kind of scary,
So I'd be putting on all of this. You have to put it safely, and then you could be in a lot of danger. But if I have too many other patients and everybody's oxygen is falling, I have to say it, patients will die.
Yeah, completely overwhelmed.
And so this is, St. Vincent nurses had too many patients to be able to provide that safe care. But also, Tenet was not hiring the aides, the patient care assistants, to back up the nurses. If I'm in your room cutting corners and there's a patient I'm worried about who's falling, having an aide who could go into and make sure that patient was safe makes everybody safe. Yep. So they were cutting those, they were cutting, and they were cutting secretaries, so there was nobody to answer the phone. I'll tell you right now, there's a beeper that usually a nurse carries as a resource so she can be reached and she can make decisions about patient care. Right now in the hospital, the secretaries are carrying those pagers.
Wow.
Tenet, you know, it's their responsibility is to their shareholders to return good dividends to their shareholders, and ours is our patients have to be safe. That is why those nurses.
You know, they're putting lives on the line. So here's what I have to duly note something, that during the pandemic, you know, state and federal lawmakers raised, I think we raised $2.5 trillion, right, to get people through this difficult time and put all this money out there and lay it all out there for people. And what I don't understand, this could have happened. The administrators, the hospital administrators that were fighting this ballot question back in 2018, I know they didn't see this coming. Many of us didn't. Maybe Fauci knew about this a long time ago. Who knows? He, you know, they're always thinking about Gupta or someone like that.
Yeah,
you know?
yeah.
But I mean, God, it's just crazy that all that money was, you know, has been raised because of this now. We're robbing Peter to pay Paul. Many, many people have died. I'm sorry to say, some probably it's unnecessary at times, and I feel really terrible about that whole thing.
Yeah, you are right.
So my next question is, the strong resolve that the nurses have over St. Vincent's, because to me, I couldn't imagine being on a picket line for 7 months. I mean, I don't know how they're doing it. So the other thing that I have is, I want to ask you how they're holding up financially. How are they doing that?
Oh my goodness.
How is this happening? How are they making ends meet?
So Tenet blocked our unemployment insurance for 9 weeks. You know, but the Secretary of Labor, former Boston Mayor Marty Walsh, has been a good friend. He's a good friend to labor.
Of course he is.
He is what a good choice President Biden made.
Always has been.
So Secretary Walsh made sure that we got unemployment benefits, but the majority of nurses went 9 weeks without a paycheck. So
that's brutal.
Brutal. Tenet also blocked our COBRA. So
COBRA
nurses had no.
So for those at home who don't know what COBRA is,
thank you.
That's it's kind of like an insurance, right? It is insurance, but it's when you're not employed.
It's so expensive. So when you lose your job and you lose your health insurance, another thing, employer-based health insurance.
Yeah.
Let's make that pitch for Medicare for all. So the nurses lost their insurance immediately. And COBRA is, you know what it stands for, I can't remember.
I should know this, but I don't.
Too.
I apologize.
And so you're able to buy insurance, but you pay the full premium. It's very, very, very expensive. But we got that subsidized through the CARES Act. But, you know, it's very interesting.
The FFCRA, yeah.
Right? When the federal government gave this money that you're talking about, they gave Tenet $2.8 billion. Oh $2.8 billion.
Well, I want to mention something about that. I want to mention something about because I wanted to talk about Tenet, but I'm glad you're all over Tenet, like nobody's business here. So let's see. They announced profits of more than $400 million.
Yes.
And then they announced profits of more than $97 million for the first quarter of 2021. This is what the Nurses Union has given to Melissa Hansen. Of Mass Live, I want to make sure that she gets credit for that. So that's unbelievable. So I guess you're right. The state court ruled striking St. Vincent Hospital nurses no longer qualify for unemployment. That happened. Was that back in August at some point?
Yes.
And then Marty overrode that.
No. So he did that back in April, when we were trying to, because normally on strike you don't always get unemployment, but he made the determination that this was a legal strike, and the legalities said that we could.
Where is that at right now?
So what happened is then we were running out in August, and so Tenet was saying, they were proposing that we weren't eligible for unemployment and we would have to pay it back, and we're still fighting that.
So Are you not getting unemployment again?
It has run out. You know, the
run out,
extended benefits ran out in the beginning of
So
September.
what
We have a
hope do you
strike
have?
fund.
Okay.
We have a strike fund. Other unions have been incredible. Like all over the country, people are making donations.
Is there any, tell me what it is.
AFL,
tell us,
CIO.
if you want, we can put it up. We'll put it up here so you have it.
Yeah.
And it'll be very important to us to
Absolutely.
ask people if they could help.
Yes, you know, massnurses.org. If you go to our website, it'll have links to the St. Vincent Strike Fund because, you know, we have 700 nurses. They've got families. They're dedicated. They're on the line.
And they're still out there, man. I don't know how they're doing this.
Still out there. Yep.
All right, so let's talk about replacements, shall we? So they hired replacements? Yes. Okay. How's that working out for them? What do you know?
So, well, of course, they have people who cross the picket line that they brought in from out of state. You know the terminology for that.
We do.
We do. And now they are starting to hire permanent replacements, which we are also fighting. So, and we feel, you know, we feel that the care is unsafe. There have been injuries. There's been at least one death. Most of us who work in other hospitals in Boston are getting the transfers out of St. Vincent Hospital. We're very concerned about the level of care. We're very concerned because you and I both know that when you're in a union and you are organized labor, you have a voice. You have a voice because you have your union standing behind you, and you can say, you know, that's not safe. You need to stop doing that to any other healthcare professional. So our union voice is very important at the bedside. And so now we've actually resolved most of the issues in the strike.
Yeah.
But now Tenet is refusing. There's about 100 nurses that they are refusing to give them their jobs back. Now you and I both know that at a legal strike, when you go back, your return to work, everybody goes back to their jobs.
You're rolling right into my next question,
Okay.
right? So, and I'm glad you set that up for me, because I read something that there's a risk that the company Tenet Healthcare may not guarantee some of your members, if not all, some, who knows, maybe most of them, will return back to the same positions that they held before the strike began. To me, this is like almost like a retaliatory act.
It's retaliation. Exactly.
Well, I know a little bit about that.
You do, exactly. So that's what it is. That's what it is.
I know.
We've resolved the staffing issues. We both compromised. Because we need to be back in that hospital. We need to be back in there.
Yep.
So we've made our compromises. It's the return to work language. That's the one issue.
Let me ask you this question. What does it feel like for people, for nurses, because they were out there just slugging it out, man, 15, 20 rounds, whatever it took, and you see these heroes to zeros.
Yep.
That is such, it's so devastating to see that.
It is. It really is.
It's a deflating kind of a thing and how people feel. So 7 months later, we get 700 people out, 700 people out there protecting.
Yes.
They're actually protecting our livelihood as well too. I mean, I represent school nurses.
Yeah.
And we know how wonderful school nurses are as well, and the things that they do. And you know, they had their issues too when it came to going back and bringing children back, and they're keeping everybody safe, not just themselves. Their job is to try and keep them all safe.
You know, Ed, that is a subject for another story.
I know.
What's happening with school nurses, it's criminal. But that's another conversation.
We'll get into that on another show. All right, so
yes.
What is the risk that nurses, that could be jeopardizing their licenses due to too many assigned patients?
Right.
What is that? Is there a risk there?
There really is. And so we actually, at the Massachusetts Nurses Association for years, we actually fill out legal forms. I mean, that where we say, we have told you this is unsafe. We must have more nurses, or we must have more support. This is unsafe. And we are saying, we're notifying you as management, and so if something happens, you have been notified, and we are not taking responsibility. And before St. Vincent went on strike, they had filed over 600 of these.
All right, so I don't want to get into the minutiae of that, but I get it, because I know that they probably have to file a form and do all this
Exactly.
this stuff.
We notify management. We say, this is unsafe. We've told you, because our licenses could be at risk. So we have to say, we know, we told you that this is unsafe. We don't have enough nurses to care for these very, very sick patients.
Exactly.
And we have a law in Massachusetts that the Massachusetts Nurses Association pushed through in 2014 that limits patients in ICU, in the intensive care units, but nowhere else.
Right, that's the only thing. We talked about that the last time.
Yeah.
So you can look into the camera if you want, whatever one you want. You can tell the people, the viewers, this one over here.
Okay.
Right? If you can just say yes or no, right? Is this about money, or what is this mostly about? What is it about? Tell everybody what it's about, because everybody thinks it's always about money.
Right.
Right? What is it about?
This strike is about safe patient staffing. And that's what it's about. I've been on the picket line sometimes every single solitary day. I've talked to nurses who work in every part of that hospital, and they all tell me the same story, that the assignments are unsafe. This is only about patient safety. And we're talking maybe that on a shift, one more nurse. Tenet posted, as you saw, $400 million profit. They've spent over $110 million. And I know that number from about a month ago, so I'm sure it's got to be another.
Oh, yeah.
To prolong the strike. A fraction of that amount of money could have resolved this.
My question is, when are you planning to go back to the bargaining table, or is this just like now in this zone now?
We're in this place. We've been at the table. We've always said to Tenet, we will come back to the table because we believe in that.
Right.
But right now they are saying, no, there are 100 nurses who they can come back, but we're not going to give them their jobs back.
Right, exactly.
So they can, and these are nurses who have had 20, 30, 40 years.
That's my next question too. Are you concerned that you're going to lose, you may lose some good nurses who can't wait it out? Are you really worried about that?
That's so interesting, because these nurses who have been on the picket line for 7 months are still so dedicated to this hospital.
Yeah.
I've been walking with nurses who are due to retire, but they said to me, I'm not going to retire. I'm going to see this through. No, the vast majority, I believe, will go back.
Okay.
Yep.
I wanted to ask that question. How about, this is just a quick one, any more visits to revisit that question, question one? Safe pay. You can only bring that up so many times, right?
Well, there's I think that when you
ballot.
put it on the ballot, I want to say it's 7 years. You cannot bring that same question to the ballot. I think 7 years. I don't think it's 9 years. So we can't bring it back. But no, we have bills in the legislature saying, okay, let's do a study. Okay. You say that it's not safe or it'll cost money. Let's do a study. So no, we're always trying to address it.
Okay, I know that's been going on for years, but someone said it was decades. I couldn't believe it.
It is.
Do you also represent CHA?
Yes.
Okay, Cambridge Health Alliance, and nurses there and all of that. I know there was some issues going back with Somerville, Cambridge, and Everett.
Yes.
Has anything resolved on that end?
Yeah, they resolved all of their contracts.
Beautiful.
So we were at the table, all three of us, and there were different issues at different hospitals. So that's why it's called negotiation. So we, work it out, and we probably didn't get everything we wanted, but there was also, right? Exactly.
I'm going to tell you, man, that's why they call it bargaining.
But it was, again, being on those lines, nurses are dedicated to their hospital. And, here in Somerville, it was so wonderful to have support from the state reps who represent and the city council and city council candidates. People see the value of Somerville Hospital.
They know who you are, and they understand.
And they see the
value. I
always
ask one thing whenever I have the opportunity, I get the ear of a politician. Please don't forget about us.
Yeah.
We're a union. Please don't forget about us.
That's great.
When election time comes around, we're there for you.
Yes.
Please just don't forget about us.
Right.
So I want to touch on
one
quick thing, because Drew's only got a few minutes left.
Okay.
He's banging away over there telling me I got to get out of here. So here's a photo of a security guard, John Wood. He stands in the triage area at the emergency department at the Massachusetts General Hospital. Now, why would we need, right? Why would we need a security guard there? I don't know why we would, but I guess I'm going to tell you why. Mass General Hospital says 2 of 3 of its nurses face assaults every day. This is by Beth Haley, October 1st. Here's a chilling statistic from one of Boston's most prominent medical institutions. On any given day, 2 to 3 nurses at Mass General Hospital are assaulted. The incidents can range from a shove, a kick, verbal harassment, or even threats by patients, according to hospital officials. Bonnie, is it Mitchellman, I believe, is a Mass General Hospital director of the police and security, estimated that assaults are roughly 40% unintentional and 60% intentional. Intentional assaults can involve people altered by drugs or alcohol, she said. The unintentional cases are often older patients with dementia or Alzheimer's who have changed from their normal personality to a personality that can be radically volatile. Mm-hmm. The stresses, this is somebody sitting right beside me who said this, right? This would be you. I have a quote from you here. The stresses of receiving and providing health care during the pandemic have surged, according to Katie Murphy, an ICU nurse at Brigham and Women's Hospital in Boston and president of the Massachusetts Nurses Association. And a shortage of psychiatric beds in the region has been a big contributor to the prevalence of patients lashing out. So, do you have any comment on this? Any personal experience for about a minute you want to give us?
It's, you know, there's always been violence against healthcare providers, and it's not just nurses. You know, it's first responders, right. It's doctors, it's nurses, it's respiratory therapists. We tend to be the closest to the patient for the greatest length of time. And so, but what you've seen in the pandemic, number one, it's been absolutely awful. People have lost a lot of their support systems, and so that we're seeing far more mental health issues. Yep. And I think
social
we're
workers,
see them
I've talked to social workers from the SEIU
right?
union. I know a lot about that. I've interviewed people on that. Well, you've been a great guest. I want to thank you for being here. I know it's really difficult getting here in the Somerville, right? Beautiful Somerville out there.
Yep.
Here we are in Union Square.
Beautiful day, yes.
Yeah, it's a great day here in October. And here we are, right here, St. Vincent's. We support you, 1,000% if that's even possible. I want to thank you all very much for watching this show. And I always like to give you a little something. I think you got a nice T-shirt.
Oh, I still have it.
Is it only in Somerville T-shirt? We don't know what it is, but whatever it is, it's a beautiful shirt. Okay, because all the shirts that we make are beautiful.
Oh my goodness, yes.
So this is the Prospect Hill Tower, right there. Okay, and it's not far from you go up Stone Avenue, and this is it's a wonderful place to visit. It's been all done over.
Oh my goodness, in unity there is strength.
Right.
That is fantastic.
That's right. And don't forget, this is a women's cut, all right? We don't mess around over here. And I want to give this to you as a gift. Thank you so much for being on the show.
Thank you so much. I will wear that with such great pride because I do. The other one you gave me has this, I think, in a very, very big logo.
What it has is that logo right there, but it says only in Somerville. So many of the things that you see
so much.
happen only right here in Somerville. We're very unique.
You are.
We are. It's a great place. Live, work, play, whatever they say. That's their tagline. Thank you very much. Over and out. When we fight, we win. And usually there is strength. Thank you, Katie Murphy.
Thanks, Ed.
All right.
It was an important show, and I'm glad to be here.
I'm glad you were here. You kidding me? Great to have you here.